Welcome back. Continuing with lecture 7, we're now going to talk about some of the major peripheral nerves that we're going to find out in the body as opposed to cranial nerves that are coming in and out through the brain. These are all branches of spinal nerves. So first I want to focus on the 3 main nerves that we're going to find in the upper extremity. So the upper extremity includes the arm and then the forearm. So this is the forearm, and then of course the hand. So the median nerve, as you can see in this, let's see if I do a highlighter. So you can see here, the median nerve, switch to green. The median nerve travels down kind of the middle, the center of your arm and forearm, and then it's going to supply the first 3 digits on the hand. So that's what we would call the distribution of the median nerve, and it is a mixed nerve. All 3 of these nerves are, and so it's going to be supplying all the muscles along the way. So think about your biceps. Oh, that one's a different one. Sorry, I think all the muscles in your forearm, or here we go, on the anterior surface of your forearm, the flexor surface of your forearm, and then it's going to come through here in the wrist and then supply this side, this kind of thumb side of your hand, and it's going to supply the muscles there so that you can move those muscles as well as give you sensation so you can feel things on that part of your arm. And then next is the ulnar nerve. So I'm going to switch to blue for that one. And the ulnar nerve, as you would imagine, kind of travels down the ulnar side. So that's going to be on the kind of the pinky side then. It's going to supply the pinky side and a little bit of the middle finger of your hand, and then that ulnar side in terms of sensation, as well as some muscle control, because you actually have some muscles over here too that are going to receive their signals from motor neurons that are traveling in the ulnar nerve. And then finally, we have the radial nerve. I guess I'll use purple. So the radial nerve is mostly on the posterior aspect of the arm, and then it kind of spirals around. This person has got their hand turned this way, so we're looking at the back of their hand. So the radial nerve is going to supply kind of the back side of your arm, so the triceps muscle, and then it's going to come and supply what we call the extensor surface of your forearm, so the muscles that extend your fingers and extend your wrist, and then it's going to supply kind of the thumb side of the back of your hand, so it's going to be supplying muscles as well as sensation. So those are the 3 main nerves that we're going to find in the upper extremity. And you've interacted with some of these. So the ulnar nerve is interesting because, well, lots of things about it are interesting, but one of the interesting things about it is if you look in this little circle here, it travels right around a bony part of your arm. So if you bend your elbow, and you feel the little bumps. So here's the main bump of the point of your elbow. That's your olecranon process. And then you feel the 2 little bumps, one on each side. Those are the epicondyles of your humerus. And so in between the point of your elbow and the bump on the medial or inside side, in there, that's where your ulnar nerve has to travel. And it's right up against the bone there. And so if you bang it, that nerve gets slammed up against the bone. There's nowhere for it to go, and the nerve gets injured. And so that's what happens when you hit your funny bone, is you're actually hitting that ulnar nerve. And so it like freaks out and it sends these signals, and you get this shooting pain down that distribution of your ulnar nerve. Or you might get tingling or numbness or for a variety of things until that nerve kind of recovers from that injury. So your ulnar nerve is the one responsible for that sensation when you hit your funny bone. The median nerve is also familiar to many people because it is the median nerve that is the problem when people get something called carpal tunnel syndrome. So the carpal tunnel refers to a particular region in the front or anterior side of your wrist here. And the median nerve has to travel through it. And so there are a variety of things that can cause the median nerve to kind of get compressed as it moves through that tunnel. It's kind of a narrow space. One of them is if you sleep with your hands kind of like that. But so lots of different things can compress that nerve. And if that happens, then you're going to get symptoms in that nerve distal to the area of compression. So you can see the area outlined in blue here. You can get tingling, numbness, pain, and sometimes if it's severe, you can even get weakness in the muscles that are normally supplied by branches of that median nerve, because if it's not working, those muscles aren't able to contract, and so the muscles can just waste away and atrophy. So carpal tunnel syndrome is due to compression of the median nerve, and you get both motor and sensory symptoms because it is a mixed nerve. All right, all of those nerves coming to the upper extremity come from something called the brachial plexus. Now, a plexus, you can think of it as kind of like a network of nerve fibers. So what happens in some of the regions of the spinal cord is as these nerves are coming out, instead of just coming like straight out and then branching out to different things, sometimes they're like, ooh, I'm going to combine with you, and then we're going to divide again, and then we're going to combine again. And there's this kind of like weaving that happens. And so we have up here, coming out of, it's got nerve roots coming from the C5 to the T1 levels of the spinal cord, kind of pointed out here. We have this brachial plexus, which is this kind of network of nerve fibers that kind of bob and weave together and then eventually separate out, and you can see kind of turn into these nerves that are then going down into the upper extremity. So the radial nerve, the median nerve, and the ulnar nerve are all branches off of the brachial plexus. We're going to move now into the lower extremity. So there are two nerves that you're going to find kind of on the front side of the body, or the anterior surface. One is the femoral nerve. So the femoral nerve is coming here and travels down the front of your thigh. So the femoral nerve is going to supply the anterior thigh. It's a mixed nerve, so with both sensation and motor control. So those muscles on your anterior thigh, your quads, it is the branches of the femoral nerve that signal them to contract when you want to extend or straighten your knee. The obturator nerve is one you may not have heard of before. Let's see which color it's going to show up. Let's try purple and see. It's shown in green on this KenHub image, which I think is not showing up very well. And that purple isn't showing up well either. Let me try yellow. So I'm going to draw it in yellow, yeah. So the obturator nerve kind of comes through here, and it comes down here, and it supplies the medial thigh. So the muscles of the medial thigh, of which there are several actually, and the sensation on the inside of the thigh, that medial thigh, is all coming from the obturator nerve. Now you may have noticed on the previous diagram that these nerves are coming off of a plexus. So this one, because it comes out from the spinal cord around the lumbar vertebrae, is referred to as the lumbar plexus. You might be like, wait a minute, why was the brachial plexus called the brachial plexus then? Because those aren't the brachial vertebrae. Brachii means arm, so it's the arm plexus, right? So this one's called the lumbar plexus. And so again, we see these kind of recombinations of nerve fibers, and then eventually they kind of come down. So this one actually right here is the femoral nerve. This one over here is the obturator nerve. So both femoral and obturator nerves are branches off of that lumbar plexus. The big kahuna nerve, though, for the lower extremity, the one that supplies every other part of the lower extremity, is the sciatic nerve. It is the biggest nerve in the human body. It is as thick as a watch strap, and I mean like an Apple Watch strap, like not just like a little Timex, right? So it's really thick. It's got tons of axons in it because it's going to be supplying the posterior thigh, right? So the anterior and medial of the thigh were supplied by the femoral and obturator. So it's going to supply the posterior thigh, and then basically everything from the knee down. So all of the muscles in your legs, so all of your calf muscles, your tibialis anterior, everything down in your foot. It's a mixed nerve, so again, both motor and sensory. So both muscle contractions and sensory information are traveling through different axons through this sciatic nerve. You may have heard of the sciatic nerve because in some people it gets irritated or inflamed, which is a condition called sciatica. So you can imagine, since that nerve does so many things, if it gets pinched or irritated or inflamed, you can get pain or tingling or numbness or sometimes even weakness in the muscles of that whole region of its distribution, of the places that the sciatic nerve supplies. So back of the thigh and anything from the knee way down. So this is a relatively common condition. It can be caused by things like herniated discs, or sometimes just a sprain, or a muscle can be kind of pinching on it. One of the things when I used to do family practice, when I used to work in a doctor's office, people who have their wallet in their back pocket, so especially if they were a truck driver and then they were sitting on that all day, that's basically where your sciatic nerve is. So that wallet was kind of digging into their sciatic nerve all day, every day. So that can be a cause of sciatica as well. The sciatic nerve comes off of the sacral plexus, which is shown in green here. I hope you can see it, because it's coming out of the sacral area of the vertebral column. Those nerve roots are. And so again, they're kind of meshing together and then separating, and the sciatic nerve is a branch off of this sacral plexus. So overall, there are 3 plexuses coming off of the spinal cord that I want you to know. So the first one is the one that's up here, which is the brachial plexus, which they've kind of shown you here. And so that's where our median ulnar and radial nerves are going to branch off of. Then I want you to just notice that as we kind of move down here, coming off of the spinal cord, these nerves all just kind of go straight out. They don't bob and weave. They don't mesh and network. Those are the thoracic nerves. They don't form a plexus. But then when we get down to the lumbar area here, we've got our lumbar plexus, and I didn't have an orange highlighter, so this one's just highlighted in yellow, and that's the one that our femoral and obturator nerves come off of. And then below that, we have the sacral plexus, and that's shown here in yellow, and that's where our sciatic nerve is going to branch off of. So in summary, we learned about 3 branches off of the brachial plexus: radial nerve, which does posterior arm and posterior forearm and a little bit of the back of the hand; median nerve, which goes down kind of the middle of the anterior arm and can get compressed in the wrist there and lead to carpal tunnel syndrome on the thumb side of the palmar side of the hand; and then the ulnar nerve, which travels, of course, along the ulnar surface of your arm and forearm, and is the one that when you bang it, it really hurts and cause tingling and numbness in that spot. The lumbar plexus is going to give rise to the femoral nerve, which supplies the anterior thigh, and the obturator nerve for the medial thigh. And then off of the sacral plexus, we've got the biggest nerve in the human body, the sciatic nerve, which is supplying the whole rest of the lower extremity. And we talked about the condition of sciatica, where for any of a variety of reasons, so there's multiple different causes, but if the end result is irritation or inflammation of that nerve, we call it sciatica. And you can get sensory or motor symptoms because it is a mixed nerve. So that's it for the major peripheral nerves.